Something is happening to your liver right now while you sleep, and you have absolutely no idea. Your liver is one of the most hardworking organs in your entire body. It performs over 500 different functions every single day. It filters your blood. It processes everything you eat and drink. It produces the bile that breaks down fat. It regulates your blood sugar. It removes toxins and drugs and hormones from your system. And it manufactures the proteins your blood needs to clot properly. And it does all of this silently, without pain, without complaint, for years and sometimes for decades, even when it is being slowly destroyed. The liver is called the silent organ for a reason. Unlike the heart, which warns you with chest pain, or the lungs, which warn you with breathlessness, the liver has no pain receptors of its own. It cannot send you a direct distress signal, but it does send signals, indirect signals that show up not during the day when you are busy and distracted, but at night, while you are trying to sleep, while your body is supposed to be resting and recovering. These nighttime symptoms are your liver's only way of telling you that something is seriously wrong, and most people either ignore them or mistake them for something completely unrelated. I'm going to share with you today the 5 nighttime symptoms that could mean your liver is in danger. I'm going to explain exactly what is happening inside your body when each of these symptoms appears. And I am going to tell you what you need to do if you recognize any of them in yourself. Because with liver disease, the timing of when you act makes an enormous difference in what outcome is still possible for you. I am Dr. Calara, and welcome to Health Hub, where we give you honest, real medical knowledge that protects you and the people you love. Please subscribe right now if you have not already, because every week we cover topics exactly like this one. Topics that could change the course of your health if you happen to see them at the right time. And please watch this entire video because the 5th symptom is the one that most people never connect to the liver at all, and it may be the most important one of all. Before we get into the symptoms, I want you to understand something about how liver disease progresses, because this context will help you understand why these symptoms appear the way they do. Liver disease in most people follows a predictable pattern. It starts with inflammation, which is the liver's response to injury from alcohol, from a virus like hepatitis, from fat accumulation, from toxins, or from autoimmune attack. If the source of injury continues, the inflammation leads to fibrosis, which is the formation of scar tissue as the liver tries to repair itself. Extensive fibrosis leads to cirrhosis, where large portions of the normal liver tissue have been replaced by scar tissue that cannot perform liver functions. And cirrhosis, if it continues to progress, can lead to liver failure and to liver cancer. The terrifying part of this progression is how long it can take and how silent it is. A person can have significant fibrosis building up in their liver for 10 or 15 years without feeling anything specific enough to send them to a doctor. The symptoms that eventually appear are often vague enough to be dismissed. Fatigue, a little bloating, some digestive discomfort, easy to attribute to stress or aging or a busy lifestyle. And then one day, the liver reaches a tipping point, and the symptoms become impossible to ignore. But by then, the damage is advanced, and the options are far more limited than they would have been years earlier. This is why the nighttime symptoms matter so much, because they tend to appear before the obvious daytime symptoms. Because the liver's struggle becomes most visible at night when the body's normal compensatory mechanisms are less active. Because nighttime is when your body is trying hardest to repair itself, and when the liver's inability to support that repair process becomes most apparent. If you can recognize these signals now, while the disease is still in earlier stages, you have a genuine opportunity to intervene and change the course of what happens to your liver. The first nighttime symptom is severe itching of the skin, particularly at night. This is medically known as pruritus, and it is one of the most classically liver-related symptoms that exists, yet it is almost never recognized by patients as having anything to do with the liver. People with this symptom think they have dry skin, or an allergy, or a reaction to their laundry detergent. They try moisturizers and antihistamines and changing their soap. And nothing works because the itch is not coming from the skin at all. It is coming from inside the body. When the liver is damaged and bile flow is disrupted, bile acids and other compounds that are normally processed and excreted by the liver begin to accumulate in the bloodstream. These compounds deposit in the skin and stimulate nerve fibers there, producing an intense itching sensation. The reason this itching is worst at night comes down to several factors. Body temperature rises slightly at night, and warmth intensifies the sensation. The skin loses more moisture through the night, which affects the nerve endings. And most importantly, the distractions of daytime activity are gone, and the brain focuses on the sensation with much greater intensity. This liver-related itching has a distinctive pattern that distinguishes it from ordinary dry skin or allergic itching. It tends to affect the palms of the hands and the soles of the feet particularly intensely. It may spread across the torso and limbs. It does not involve a visible rash in most cases, which is one reason it confuses people so much. There is nothing to see on the skin, but the itching can be absolutely maddening, sometimes severe enough to prevent sleep entirely and to cause people to scratch until they bleed. If you are experiencing itching that is worse at night, that is not explained by any obvious skin condition, that particularly affects your palms and soles, and that has not responded to standard remedies, please tell your doctor and ask specifically for liver function tests. The second nighttime symptom is waking up repeatedly during the night, particularly between the hours of 1 and 3 in the morning, with feelings of restlessness, anxiety, or simply an inability to stay asleep. Traditional Chinese medicine has long associated this specific window of nighttime waking with the liver. And while Western medicine approaches this differently, the underlying biology actually supports a real connection. The liver performs some of its most intensive metabolic work during the overnight hours. Blood sugar regulation, detoxification of compounds that built up during the day, processing of hormones, and production of proteins all peak during nighttime liver activity. When the liver is struggling, these processes become inefficient and dysregulated. Blood sugar may drop during the night as the liver fails to release stored glucose at the right rate, triggering a stress response that wakes you. The accumulation of ammonia and other toxins that a healthy liver would process can affect brain function and disrupt normal sleep architecture. The anxiety and restlessness that accompany this nighttime waking are not psychological in origin. They are physiological. They are the brain responding to chemical imbalances that the struggling liver is failing to correct. This pattern of nighttime waking is different from ordinary insomnia. People with ordinary insomnia tend to have trouble falling asleep initially or wake up very early in the morning and cannot get back to sleep. The liver-related pattern is more specifically characterized by waking in the middle of the night, often at a fairly consistent time, with a feeling of unease or inner agitation that can be difficult to describe. There may be sweating. There may be a racing heart. There may be a vague sense of anxiety without any identifiable cause. If this pattern sounds familiar to you and you have any other risk factors for liver disease, including alcohol use, obesity, a history of hepatitis, or a family history of liver disease, please have your liver evaluated. The third nighttime symptom is right-sided abdominal discomfort, or a dull, aching pain under the right rib cage, that is particularly noticeable when lying down. The liver sits in the upper right quadrant of the abdomen, tucked under the rib cage. As I mentioned earlier, the liver itself has no pain receptors, but the capsule surrounding the liver, called Glissen's capsule, does have pain fibers. When the liver becomes inflamed or enlarged due to disease, it stretches this capsule, and that stretching produces a sensation of pressure, fullness, or dull aching pain in the right upper abdomen. This discomfort tends to be more noticeable at night for several reasons. When you lie down, the pressure dynamics in the abdomen change, and an enlarged liver may press against surrounding structures in a way that is less apparent when you are standing or sitting. Physical activity during the day tends to suppress awareness of chronic, dull pain, and the shift in focus that comes with trying to relax and sleep makes you more sensitive to sensations that your busy daytime mind was filtering out. Many people with this symptom describe it as a sense that something is not quite right on the right side, a heaviness or fullness that they cannot fully explain, sometimes accompanied by a feeling of pressure that extends up into the right shoulder. That radiation of discomfort into the right shoulder is actually an important diagnostic clue. It happens through a phenomenon called referred pain, where the diaphragm, which lies directly above the liver, becomes irritated by an inflamed or enlarged liver pressing against it. The nerve fibers from the diaphragm share pathways with nerve fibers from the shoulder, so the brain sometimes interprets the pain signal as coming from the shoulder rather than the abdomen. If you have been experiencing right shoulder discomfort that you cannot attribute to any muscle injury or physical activity, and particularly if it is accompanied by any right-sided abdominal fullness, please mention both symptoms to your doctor together. The fourth nighttime symptom is excessive sweating and feeling hot, particularly at night, in a way that is different from normal night sweats associated with menopause or infection. The liver plays a central role in metabolism and heat regulation. It is actually the primary heat-generating organ in the body during rest, producing warmth as a byproduct of its intensive metabolic activity. When the liver is diseased and its metabolic processes are disrupted, temperature regulation can become abnormal. Additionally, the liver is responsible for metabolizing and clearing a wide range of hormones from the bloodstream, including estrogen and cortisol. When liver function is impaired, these hormones accumulate to higher than normal levels. Elevated estrogen in both men and women can cause night sweats and feelings of excessive warmth. Elevated cortisol, the stress hormone, can cause sweating and a hyperactive physiological stress response. Men with liver disease sometimes notice breast tissue development and other signs of hormonal imbalance that are directly caused by the liver's inability to break down estrogen at the normal rate. The night sweating associated with liver disease tends to be diffuse, affecting the whole body rather than just the head and neck, as is more common with menopausal hot flashes. It may be accompanied by a flushed or reddened appearance of the face. It often comes with a feeling of being overheated from the inside rather than from external warmth. And it typically occurs even in a cool bedroom, which helps distinguish it from sweating that is simply a response to an overly warm sleeping environment. If you are soaking through your night clothes regularly with no other clear explanation, and particularly if you have any of the other symptoms in this video, liver function testing should be part of your evaluation. The fifth nighttime symptom, and the one I promised you that almost nobody connects to the liver, is vivid, disturbing dreams, nightmares, and an overall sense of mental unease or brain fog that is worse in the morning than it was when you went to bed. Most people, when they experience persistent nightmares or mental fog on waking, think about stress or anxiety or poor sleep quality, or perhaps depression. Very few people think about their liver, but the connection is real, well documented in medical literature, and deeply important. Here is what is happening. One of the liver's most critical functions is processing and clearing ammonia from the bloodstream. Ammonia is a toxic byproduct of protein metabolism. It is produced continuously in the gut as bacteria break down proteins and as cells throughout the body metabolize amino acids. In a healthy person with a healthy liver, this ammonia is rapidly captured, converted into urea, and excreted by the kidneys. The blood ammonia level stays very low, and the brain is completely protected from it. When the liver is significantly damaged, its capacity to process ammonia is reduced. Blood ammonia levels begin to rise, and ammonia is profoundly toxic to brain tissue. Even mildly elevated ammonia levels affect neurotransmitter function, disrupt the normal balance between excitatory and inhibitory signals in the brain, and impair cognitive function in ways that can be subtle at first, but become progressively more severe. This condition is called hepatic encephalopathy, and in its early stages, it can manifest exactly as what I described: vivid or disturbing dreams during sleep, a sense of mental unease or confusion on waking, difficulty with concentration and clear thinking in the morning, subtle personality or mood changes, and a general sense that the mind is not working as sharply as it should. This early stage of hepatic encephalopathy, sometimes called minimal or covert hepatic encephalopathy, is significantly more common than most people realize. Studies suggest that a substantial proportion of people with liver cirrhosis have this condition without knowing it. They notice that their thinking is a little slower than it used to be, that they feel mentally foggy, especially in the morning, that they are having more vivid or troubling dreams, but they attribute these changes to aging or stress or poor sleep, rather than to their liver. By the time the encephalopathy becomes obvious, with significant confusion, disorientation, or altered consciousness, the liver disease is typically very advanced. If you have noticed changes in your mental sharpness, particularly in the morning, if your dreams have become more vivid or disturbing in a way that feels different from before, if people around you have mentioned that you seem confused or that your personality has changed, please take this seriously. These are not signs of normal aging. They are potential signs of a liver that is struggling to protect your brain from the toxic byproducts of normal metabolism. Now I want to talk about what you should do if you recognized yourself in any of these 5 symptoms. The most important first step is to have a conversation with your doctor and ask specifically for liver function tests. A standard liver panel includes measurements of several enzymes, specifically ALT and AST, which are released into the bloodstream when liver cells are damaged. It also measures bilirubin, which is the yellow pigment produced when red blood cells are broken down, and alkaline phosphatase, and tests of the liver's protein-producing function. These tests together give a picture of how the liver is functioning and whether there are signs of damage or disease. If your liver enzymes come back elevated, do not be reassured if your doctor says they are only mildly elevated and suggests watching and waiting. Mildly elevated liver enzymes that persist over time are a signal that deserves investigation. Ask about the possible causes. Ask about imaging of the liver, such as an ultrasound, which can show the texture of the liver tissue and detect enlargement, fatty infiltration, or structural changes. Ask about a fibroscan, which is a specialized ultrasound technique that measures the stiffness of the liver tissue and can quantify the degree of fibrosis present. Ask about a referral to a hepatologist, which is a specialist in liver disease, if there is any ongoing abnormality. On the lifestyle side, there are things you can begin doing immediately to reduce the burden on your liver and support its function. If you drink alcohol, reducing or eliminating it is the single most impactful change you can make for your liver health, regardless of whether your current liver problems are alcohol-related. Alcohol is directly toxic to liver cells, and it accelerates damage from any other cause. Even moderate alcohol consumption contributes to fat accumulation in the liver and to ongoing inflammation. Non-alcoholic fatty liver disease, which is caused by excess fat accumulation in the liver in people who drink little or no alcohol, is now the most common liver condition in the world, and it is driven primarily by diet and body weight. Reducing refined carbohydrates, sugar, and processed foods is the most evidence-supported dietary approach for reducing liver fat. Studies have shown that even a 10% reduction in body weight produces measurable improvements in liver fat content and liver function tests in people with non-alcoholic fatty liver disease. This is not about achieving an ideal body weight. It is about reducing the fat load on a liver that is already struggling. Coffee is one of the most thoroughly researched foods in terms of liver protection. Multiple large studies have found consistent associations between regular coffee consumption and lower rates of liver fibrosis, cirrhosis, and liver cancer. The protective compounds in coffee appear to reduce inflammation in liver tissue and slow the progression of fibrosis. 2 to 3 cups of regular coffee per day is associated with measurable liver benefits in the research literature. This applies to caffeinated coffee, and the protective effect appears to be at least partially independent of the caffeine itself. Foods that support liver function and provide the nutrients liver cells need include cruciferous vegetables like broccoli, cauliflower, Brussels sprouts, and cabbage, which contain compounds that enhance the liver's detoxification pathways. Garlic contains sulfur compounds that activate liver enzymes responsible for clearing toxins. Turmeric contains curcumin, which has anti-inflammatory effects specifically in liver tissue. Berries provide antioxidants that reduce oxidative stress in liver cells. Olive oil, when used instead of other cooking fats, has been shown to reduce liver enzyme levels and fat accumulation. An adequate hydration throughout the day supports the kidney function that works in partnership with the liver to clear waste products from the blood. I want to close by saying something directly and honestly. Liver disease is one of the conditions where early action has the greatest impact on outcome. The liver has a remarkable capacity for regeneration. In the early and intermediate stages of liver disease, before extensive scarring has occurred, the liver can recover substantially if the source of damage is removed and the right support is provided. People who catch liver disease early, who make the necessary lifestyle changes, who receive appropriate medical treatment, can prevent progression to cirrhosis and live full, healthy lives. The people who face the worst outcomes are the ones who had symptoms and waited, who had those nighttime warning signs for years and told themselves it was nothing. By the time pain or jaundice or swelling of the abdomen brought them to the doctor, the window for easy intervention had often passed. I am not sharing this to frighten you. I am sharing it because I genuinely want you to be one of the people who acts early. One of the people who takes a symptom seriously, gets a blood test, finds out what is happening, and does something about it. While doing something about it still makes a big difference. Please share this video with everyone you know, with your family, your friends, anyone who has mentioned unusual tiredness, or itching, or digestive discomfort, or poor sleep. The person you share this with might be the person whose liver gets caught in time. Thank you so much for watching all the way through. If this video helped you, please give it a like because it helps more people who need this information find it. Leave a comment below and tell me which of the 5 symptoms surprised you the most. Subscribe to Dr. Calara Health Hub because every week we bring you exactly this kind of honest medical education that you can trust and that could change your life. I am Dr. Calara, and I will see you in the next video. Take care of your health because no one else will do it for you.